views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hello and welcome to Bellas Fashionistas Home Edition. I am your host, Flor Sorbello. It is a pleasure to have you join us this afternoon. We trust that you and your loved ones are well and staying safe. In today's Bellas Fireside Chat conversation, we welcome the founder and CEO of Niño Pediatric and also assistant professor of critical care pediatrics at Montefiore Hospital in the Bronx, who will speak to us about COVID and how it has been affecting children. It is a pleasure to welcome founder, CEO of Niño Divino, and also the medical doctor and critical care specialist at Montefiore Hospital, Dr. Nunez. Thank you so much for joining us this afternoon.
Thank you so much for inviting me. It's a pleasure and an honor. Thank you.
Give us more about who you are and what is it exactly that you do.
So I'm a pediatric intensivist. I'm a general pediatrician and also critical care. I did medicine in Dominican Republic. I'm Dominican. I was born here, raised in DR, and graduated very young from medical school at 21. And then I did pediatrics. I came back here, got married, had my kids, and then came back here. And then here I did pediatrics, general pediatrics. And then that was 3 years, and then 3 more years in critical care at Montefiore. And there I'd stayed at the ICU. But during that time when I was in the ICU, especially during my training, I had a lot of parents, Latino parents. I was the only Latina there at that time. Still, there's just very few. I've trained 2 more Latinos in the critical care arena. It's very difficult to get into critical care. It's very intense, very stressful. Long hours, 24 hours, 72, anywhere from 16 to 72 hours working. So it's very stressful. So not a lot of people like it or who would like it. A lot of people stay in it. So once I did that, I had a lot of parents coming to me as Latinos and asking me, where's your practice? And I really didn't want to do a practice because it's I didn't want to be sitting on, I like actions, so sitting behind a desk and talking to parents. But I don't know, some hearts, Latinos, and my husband also supported me very well. And he's like, let's try to do something. I said, okay, so if I'll do something, I'm going to do it where I really, really need it, because I'm not going to go from the ICU to the community and just be in a place where I'm not going to see my people. So we did a lot of research, a lot of nights, looking at the internet, looking at maps and looking at places, and found this. It was really God sent because I didn't know where, but walking throughout the Bronx, we found it was the Bronx, the place to come. And because Manhattan had a lot of doctors per capita per patient, so a lot of patients. So one doctor didn't have a lot of patients. Here, there's a lot of patients without physicians, so especially Latinos, and very few Latino doctors. So we did that research, and then we just walked by one day and saw this pizzeria. And the gentleman was so sweet. He saw us, we were young, and he's like, I'll give it to you guys for free for a little while so you guys can start to set up. We started setting up one room at a time, and slowly we created a pediatric practice.
Now there's this kind of new wave. I don't want to call it new wave, but there's this new thing that has developed, and it has hit your demographics, right? Our community and everyone else that's part of it, but mostly children from 12 to 15 years old. Could you tell us why that is? And can you just give us a brief of why you think that's really happening now?
So one of the things that, we were getting the data, initially it was just a pandemic, right? Everybody was going literally crazy. It was a hit all over in all the fields, all the countries. And we were sort of getting the data from China, right? John Hopkins has his data. We were getting the data from China, and that's what they were saying. But there were really these hidden data that we were not paying too much attention. I really think that happened even to us as intensivists, pediatric intensivists. We had to sort of shift from taking care of pediatric patients to adults. It was like, today I come in, and literally it happened on my day. It was literally on my day when I walked in to the ICU. It was a Friday, I remember. Going into the weekend, you never have the same resources over the weekend. So during the week, you have tons of resources, right? You have two teams. One of my colleagues is in charge of one team. I'm in charge of the other team. The unit is cut in half. You have 50 people under you. You have, it's a huge team, right? During the nighttime, it's literally myself plus three other people, one resident, one fellow, and everybody else. So it's like all the floors, you're it. I remember coming in to take my call. The first thing they said, the adult is overflowed. There's nothing we can do. We have to help everybody. We're like, sure. When is it happening? Oh, just right now. We're like, oh, no kidding. Okay, great. So I was like, okay, so what's the plan? What am I supposed to do? So it was just like this huge overflow of having like one admission every hour, one admission, 6 overnight, to having 24 admissions in spans of hours. And not only pediatrics, but adults of 40, 50, 60, 70s. You're like, oh my God, intubated, very sick, very critical. So I think all that, and trying to get all that together, administration was trying to get together, who was going to help, how we can get more nurses, how we can get more people. Doctors, that was it. It was us, because we're very few intensivists, right? So getting all that together, we were getting cases of pediatrics. So we have pediatric cases. And we have very sick. We had kids that died, we have kids that had heart issues. So we had a lot of kids too. But I think it was just so overwhelming seeing the adults and seeing, I can tell you that normally my ICU days, I know when, we have like 1 or 2 deaths a night, and you can hear the hospital, CAC, you can hear it. You say, okay, sorry, we know somebody died. So you hear it. At this moment, by the Saturday, it was literally every 5 minutes. It was literally one code, another code, another code. And, your mind was going like, oh my God, what's going on? What's going on? Can I save? What can I do? It's going from one to the other. So all that, it was just not me, it was all of us. Pediatric population was there, they were sick, but the others were sicker. People were sicker and were dying. So I think that could have kind of skewed our view on what was happening with the pediatric population now. But I did remember mentioning to a lot of people, and I think one of our conversations, I did tell you that I was a little bit worried about all these adults, young adults that were coming. They had like the little trend of being obese. Like every single adult that I saw, every single young adult that I saw, 20s, 40s, 50s, I was like, why they? I called my colleague and I said, all the ones I saw last night, the ones that died, they're all obese, all young guys, young adults, and they're all obese. Like, why is this happening? And the kids are getting a lot of heart problems. Like we're seeing unusual heart conditions, dilated cardiomyopathy. So kids that their heart is getting bigger, they can't pump fast enough. The heart rate is going too high. They get into shock. We're trying to, keep these kids alive. So that started happening. But as I said, we were so overwhelmed that we couldn't think about it. Now that we hear all these cases in the news that Mount Sinai is saying, this, LIJ is saying that we're seeing it, we're all together like, wait, so you guys are seeing it too? So you guys are seeing it too. Oh, so this has been happening. But because it's so diverse, it's not like, we all thought that, and I'm saying thought because there's new theories now, that they're all having respiratory and they all need to be intubated, and then they were all dying because of respiratory issues. When we knew that was not the case were that patients were getting intubated, but they were dying because of other issues, which the heart was not working, the blood pressure was not coming up. And we were seeing that in the kids too. So now we're all putting things together and we're like, wait a second, this might be what's going on. This is what's going on with the kids now. I think it's too early and not too early, right? We all need to still get together and put all what's been happening to our kids at the same time. But definitely there is a new wave, and it's not a new wave. It's a wave that we're realizing now that kids are definitely being affected, that we have to be very careful, that we have to, teach your parents, teach the community that, that it can affect anybody. And that's why we definitely need to have all the universal precautions, because you do not know who's going to do either this, which is going to get the disease and be perfectly fine, or go to the other side, get the disease, not even know it, and in 2 or 3 days die.
Were there any healthy ones that just came in and they were able to have a cardiomyopathy and all these illnesses, or is it just because of the virus?
So a lot of these patients, as I said, the ones that I've realized, most of these patients have underlying conditions. So even just being obese, right, that is an underlying condition. Somebody that has hypertension is already an underlying condition, because with the hypertension, your vessels are not working very well, right? So these, most of these patients that have gotten sick, very sick, to the point of dying, or still in the ICU, are patients that definitely have underlying conditions. Have we seen healthy patients? Absolutely. Like out of the blue, you see once in a while one's totally healthy. Now, is it really healthy? Have we really had the time to look back and look at the past medical history and make sure this patient wasn't asthmatic? This patient didn't have hypertension, didn't have any kidney problems, didn't have proteins in the urine. Like, have we looked at it? It's too early. As I said, we've been so busy. Thankfully, there's some hospitals that have been able to dedicate some of the research to start doing some research, and we actually doing some research too. But I think it's too early to know exactly. But definitely, it has hit some healthy people too. Not only sick people, but definitely mostly the ones that have underlying conditions are the ones that have been affected the most.
How deadly is this disease to children?
We haven't seen as much deaths in children, so we don't have the numbers yet. Nobody can tell you a number. If they're telling you, it's just not. Yeah, it's too early. It's not deadly, but if you don't treat it, I can totally see it become deadly, because what happens with the heart is it stops working, and I have a lot of kids that come in with like fast heart rate, like it's called tachycardia, like fast heart rate. So those are one of the signs when you see somebody with like, if I'm looking at you, right, and you look perfectly fine, right? But if I put a monitor on you very quick, just because let's say you have a headache or you're just not feeling well, and I put a monitor on you, in the finger, pulse oximetry, or just put monitors like I normally do, if I see your heart rate going up, that's an early sign that something is going to happen soon. So it's kind of giving me a sign saying, hey, there's a warning, there's not right. So we've seen that in some of the kids saying, why is this kid having 100, heart rate of 150? His heart rate should be 80s and 90s. Like, that's not normal. So that triggers us to do an x-ray, to do an EKG, to check the heart. And that's when you see, oh, the heart is big. So what happens when the heart is big is that when you have a normal heart, you go like this, you squeeze and open to take the blood out to your body, right? When you have a big heart, this is happening. They can't squeeze, and a sick heart. So for it to squeeze the same amount of blood, it needs to do it faster because it's not squeezing completely. So that's why it's a fast heart rate. So that's what's telling me, oh, the heart is not working very well. So, and that's what we found. Fast heart rate, the heart not working very well. And then if you don't treat that, patient definitely could die.
Are these problems with the heart, is that during the virus, or can they develop heart issues moving forward after the virus?
As I say, we don't know the answer to all that. What I've seen is that we have some patients that come in negative, like don't have COVID, but they have a heart condition. They were perfectly fine before. So we're like, why are you not, like, what's going on? And then you have the same other kid, COVID positive, with the same condition, the same numbers and everything, but that one is positive. So what we're doing is that we're going based on what the condition the patient has. A normal kid, perfectly fine, and now is having heart problems. Somebody might be positive in the family. And if you have a negative swab, maybe the swab wasn't done correctly. So you don't come negative, but definitely you are positive. So so we're treating these patients as if they're positive. Can it happen later on? There's several cases, yes, that I've seen that somebody had COVID positive before 3 or 4 weeks, and now they're having some heart problems. So as I said, we don't know the answer. It's like the same thing with the adults. We had no idea. We sort of followed a trend, right? So we followed a trend of what was happening. This is going to, we have to see what happens in the next couple of days. We have to see what happens in the next surge, because it should not be any surprise for anybody, sadly. That and I always say I like to give interviews that are kind of happy, but I also like to inform, right, the parents, and we should all be prepared. The summer is coming and you're getting warm, so things gonna maybe start dying, and that's what it looks like, right? People, like, things are dying down a little bit, right? I really truly believe that September, October, when the winter starts coming back, the cooler temperatures, and when the flu starts coming back, we're all worried about the flu. There's going to be a huge mix between flu and coronavirus, and everything's going to start back again. So we really have to be prepared. We really have to train our families. We have to train ourselves to this new social distance. It's something that now, I don't know if it happens to you, but now I walk and I see somebody, like, I'm from Jersey, right? So in Jersey, we're very good at it. Like, we walk 6 feet up. We're like, I walked on Sunday and I was like, yeah, you go over there, I'm here. here in the Bronx where I'm at, I just walked outside and people are just like on top, and I'm like, oh no, over there. We have to really take care of ourselves because it's still, we don't know what's going to happen.
We will take a quick break, and when we return, Dr. Nunez will provide additional information on how parents can protect their children. Don't go anywhere. Welcome back. Dr. Nunez, what precautions should parents take to protect their children?
So it's very, very important that the parents understand, first of all, what's going on, right? That's one of the things they need to know what's going on. Second of all, they need to be calm because I talk a lot to my parents here and I talk a lot to the kids, and the kids get very, very stressed out. They're very, very stressed out with what's happening right now. They're not understanding. They're not sure why they're not in school. The little kids don't understand why you're hitting them and say, put your mask on. And they're like, okay, or go wash your hands, kind of like that. So I always tell the parents that that they need to teach their kids of what's going on with the coronavirus. Like, what is it, So, and they have to understand too. And it's not medical terms. It's just very brief understanding this a virus that causes a cold, right? But that cold can be like either a normal cold, like gripa, like people call it, right? Like gripa, or gripe, or it could be sort of in the middle, like the flu, that you get very sick and some die, or it's very dreadful that you're going to be admitted and something might happen to you. So the kids, you can't really say that. So what I do with the kids is, and I'm just touching that first and then touching what the parents need to do, is that you first need to find out when they come to me, I find out what they understand, what they know. So at what level they're at first. Like, if a kid tells me, oh my God, yeah, it's, people die, then I go, okay, I go another way. But if the kids are like, yeah, because the kids they have sort of all these imaginations, right? And you ask them, you have to figure out where they're at, right?
Right. Because of what they've seen and what they've heard.
Oh my God. Yes. Have you seen? Absolutely. Have you seen the news? I mean, you wake up in the morning, we don't put the news anymore, right? We wake up in the morning, we put, songs, we put beautiful songs in the morning, we pray the word, and because you really have to make it in the condition, because even my kids are older and one of them is home, and it's really, it's depressing. And imagine that they're young adults, imagine kids. So that's how I started. So our first home needs to be calm, right? We need to make sure that we don't, have these TV on 24/7 about everything that's going on, all the deaths and all that. You can't do that. And when you're talking on the phone, there's one of us, all of us has a family member, has a friend that somebody has died. So when you're on the phone, just be careful what you're talking. That's the first thing I will say to the parents. Second of all, teach the kids why, how. So it's a virus and it's spread, what it is. It's just an organism, something that it's contagious and it spreads to the saliva. It's what I tell them. And the way you can explain to the kids is that it's in the saliva. And I always use the example of the handle, like if you're in your room and there's a handle on the door, and I take a little bit of water and I sprinkle, I tell them, can you please cough? So they, when you cough, you sprinkle the water and that water goes into the handle, right? So you let that dry a little bit. So that's the saliva with virus going into the handle, the knob, right, of the door. Sorry. And when it dries up, you say, that's the virus right there. So now let's go outside and let's have some fun. And the kid comes and opens the door and I say, oops, what happened? What did you just touch? And like, oh, yeah, you just touched the virus. And then they go, oh, and then they touch their hands. And I say, you see, you just touched your face. And now you got infected. I know. And then they get terrified. They don't do it anymore. So then it teaches the parents. And then these kids teach other kids, teach their cousins, and they go, you know what the doctor told me? So that's how you have to sort of like tell the parents to teach their kids how you can get infected. And then, that would be the first part. There's the education of the kids of how they get infected, which is the first, and I would say the main thing that they need to do, sort of like draw to them. They want to draw, they want to do very expressive how I do it. They need to make sure the kids have hand sanitizers close by, that they can wash their hands, and that they have their face masks. We actually, in our practices, we give face masks to the kids. We give little ones, and there are a lot of people that are giving like small face masks to kids that are very colorful because they need to have them on. And some parents have their masks on, and I'm just gonna make a little, actually I had it right here. which is people love to wear their masks this way. I don't know if you've seen them, where they don't cover their nose, right?
I had it backwards the other day, Doc. Y a mí no me
But you
gusta, because I used to work in healthcare for 7 years.
There you go.
Surgeon, and my mom is a doctor, so for some reason I just walked out and I literally forgot. And I'm like, and a child, my friend's a son said, "You have it backwards." I'm like, okay, sorry.
Okay, sorry. Yeah, so for me, backwards, it's perfectly fine as long as you have it on. Like, I don't mind. As long as you have it on, that's the most important thing. So then, one of the things that they do is that they do, instead of doing this, they put it on there here, and then you have, you still have the nose coming out. So they have to make sure they understand that they have to cover the nose as well as cover the chin, okay, completely, right? Those are the two things, so things don't go inside. So they have to make sure their child have masks, right? They wash their hands before they touch any surface, and why. Like, you can just tell them, like, oh, you have to wash your hands. That is a great example of the doorknob, right? To wash your hands. But also the surfaces, like, why? It's because when you throw the water, it goes on a surface and it lands there and it stays there for days, for hours, whatever time. But you can get infected by touching it. So that's why before you touch it, then you take a bread and eat it, and you bring in the germs, the viruses. That's why you need to wash your hands. So I think education is the most important thing, but I think we need to educate ourselves. Stay calm is the next thing. Parents definitely need to stay calm, minimize what they're watching, and then also create a routine at home. They have to create a routine. They have to observe their kids very well. I have a lot of kids going into what I'm calling the pandemia number 2, which is the most important pandemia, which is like the mental health, related to mental health. These kids are home for days, home for hours, all day, days, right? Now it's months, right? And it's just these 4 walls that they're seeing, and they're seeing all this stress related, parents don't have food, they're not working, they're really, upset, a lot of violence at home. So soon we're going to see another pandemic coming out. Young adults, right? They're not used to being at home all the time, and with children. I think us adults, we can cope with stress easier than young adults and then children. So all of us, media, us, we all have to be prepared for what's coming up.
Those that have pre-compromised illnesses, what do you advise us with, for those children?
One of the things I'm worried a little bit about is that people, our Latino community, really do not understand what's going on. I had a parent to call me today, just because I was a little bit worried about this parent. Calls my secretary and says, "Oh, I want to come into the clinic today because I'm positive, and I was just tested positive, and I have a 4-month-old. I don't know what to do." And he's freaking out. So they right away tell me, I have telehealth here too. So I said, let me just call him first before we bring in a positive patient, right? We have to be careful because you don't want to spread it to everybody, because then the entire community is going to get positive, right? And the way we're doing here, and what we should do, is that we should treat every person that they are positive. Remember that. Everybody should treat everybody as they are positive, because I've had patients that come in, say, no contacts, no, yo no tengo nada, no, yo estoy bien, and you go inside and say, oh, by the way, you know what? A week ago, my cousin was positive, and I was with her having lunch, and I'm like, okay. So they don't understand. This parent says that to me, so I call him up, and he's like, I want you to check my child. And I said, okay, so first of all, how we're doing? Baby was fine. I said, I want to let you know, how long have you been like this? For a month already. I said, okay, so you just found out you're positive today. What triggered you to go today? Is because I've been having fever 2 or 3 weeks, and then yesterday I started having shaking. I said, so this has been going on for a month already. So yes, like, and your entire family has been protecting, you've been far away? No, why? I'm like, because you already had this a month ago. It wasn't today that you got this, you know that. And he's like, oh, for real? And I'm like, okay. So it was longer for me trying to educate this person to make them understand. So I'm not sure if it's, I think they're doing a great job, the CDC and all the news and all that. But I think we're just focusing so much tragedy, that people are just looking at the tragedy. Oh my God, my aunt died. Oh my God, this died with somebody, the patients were dying with nobody next to them, close, lonely, right? We're focused so much on that by the time they give the message of washing their hands, you're already given like 3 news that is like devastating. They don't hear it. Yeah, so I don't think that the community is understanding how they need to protect themselves and protect others. So if you have a patient or an adult that has complex medical conditions, you that person should treat everybody else as they were positive. So we should treat ourselves as we were positive so we don't infect the other person. So wear your mask, wear your gloves, wash your hands. Don't go close or kneel, just near that patient. Just make sure you give the basic things you need to, wearing your mask. So I think the mask definitely has proven that it's decreased, the infection rate by a lot. So make sure we wear a mask all the time, that you're self-conscious that you can infect that person. If you don't do that, there's going to be many more deaths coming.
Could you tell us before COVID and now, have you seen more patients in your office and your private practice than before?
What we've done, the patients, because everybody was closed because of the quarantine and all the regulations, social distancing and staying at home. So the volume decreased definitely, but we were doing a lot of telehealth. We're still doing telehealth, so making sure that patients do get their services at least over the phone and send them their medications directly to the pharmacy. The ones that really needed to come and see me, our doors were definitely opened, and because I didn't want my patients to go to the ER. Because I'm an intensivist, I can take care of them, and then I have my urgent care too, so I can tend to take care of all my pediatric patients and adults, the parents in the urgent care in the clinic. So we never closed our doors, but we definitely implemented more telehealth. The issue with the telehealth is that a Latino community doesn't know how to use it.
No.
Yeah, and that was a big issue. So we were trying to figure out how to Skype and who had iPhones so we can FaceTime, and thankfully the governor just, they let us use Skype and FaceTime because of protected health information. We couldn't use it before because of HIPAA regulations, but now we're able to use it. But still, our parents, it's a little bit hard for our parents to use.
I want to thank you, Dr. Nunez, for providing such instrumental information. Can you give us a little bit, very briefly, before we leave, about Niño, your foundation?
My clinic is Divino Niño Pediatrics, and which is here in Fordham Road, and the foundation is Niño de la Caridad. So so there we served over 6,000 families, and it's based more on, so we're trying to make sure that our Latino community finishes their secondary education and then help them get into college. So it's more based on academic skills and social emotional skills. And we had different programs that hopefully will run back again, but we were able to run some programs now virtually. So we have something that was actually opened by my daughter. It's named Caterpillar Homework Club, where we help a lot of kids do their homeworks in the afternoons. And now that all the school is online, it's been such a huge help. So we get interns from colleges that help their kids do homeworks in the afternoons. We have a huge waiting list. So I please urge anybody that wants to help out. We do a great screening and making sure everybody's able to take care of these kids. It's 1 hour a day, 4 days a week. So I believe it's 4 to 5, some are 3 to 4. Every day, Monday through Thursday, we help the kids do their homework. Remember, the parents don't know English. Parents have no idea what's going on. Some of the kids have to wait for the parents to come home in order to use either the tablet or use the phone because they don't have internet. So it's here in the Bronx, it's really deficient, and it's sad because our kids are not able to get the education that they need, and especially now in these days. So we help them with that. And then we also have on Fridays, Latinos Destinados a Triunfar, or Bronx Leaders of the Future. They changed the name. Now they don't like Latinos Destinados a Triunfar, which I love. But the teenagers changed the name to Bronx Leaders of the Future, which is the same platform for older kids from first grade to freshman to senior years, and just to help them with the college process and helping create Latino leaders in the community. So whoever wants to help out, call us at 917-688-1098, and they can register, and then we'll give them we'll do the screening and let them know which child they can actually mentor.
Thank you so much for joining us. Be sure to follow us on Instagram, Twitter, LinkedIn, and YouTube at Bellas Fashionistas, and our media partner at BronxNet TV. To watch more of our programming, please visit bellasfashionistas.com and bronxnet.org. Take care. Have a great day.